Australians and policymakers in particular are being encouraged to rethink the way we deal with addiction today in an Australian-wide first forum. Joining me is Professor Dan Lubman, Executive Clinical Director with Turning Point and also Professor of Addiction Studies and Services with Monash University. So Rethink Addiction is the forum. What do we need to rethink in your view?
So Tom, 1 in 4 Australians will struggle with an alcohol, drug or gambling problem at some time in their lives. That means every one of us knows somebody in their family, in their community, in their workplace that's going to be struggling with those issues. And the problem is it's one of the most stigmatised health conditions, globally. So we don't talk about it. There's enormous shame and stigma. So on average, there's around years or decades before people seek help. And we're in Canberra with people who've experienced addiction to call on policymakers to say that we need to have a national response. We need to see a change so that we can talk about this issue and change the conversation. And
so stigma is a big one. So 1 in 4 sounds incredibly high on one level. And I suppose the point about this is to be an alcoholic, it doesn't mean you wake up at 9 a.m. and have a scotch, to be really cliched about it.
That's right.
You might just have a problem ever being able to control your drinking. To be a gambling addict doesn't mean your bank account's empty. You might just realise you lose more than you wanted to. So it's getting help at that point rather than letting it spiral, I guess. Is that a key thing? It's actually how we think of whether we're an addict or whether we're willing to ask that question of ourselves.
That's right. Tom, I think the key here issue, Tom, is we need to talk about this as a health disorder. We don't see it as a health disorder. So 1 in 4 people will struggle with this issue. 1 in 20 will have the most severe form of that, which is addiction.
Right.
And so it's on a spectrum.
Right.
And the issue is that, we've all experienced during COVID and lockdowns that issue of people knowing that they're buying more alcohol, drinking more, doing more online gambling. And the question is when that becomes a problem and making sure that you identify it's an issue.
Yeah.
And if we don't talk about it as a community, the problem is that whole behaviour becomes entrenched, people feel ashamed and guilty, and they don't seek the help they need.
So I think a couple of things are quite interesting and quite cultural. We're gamblers in Australia, and I like a bet. I guess it's that point at which you think, is this a problem? And I've become conscious of kids, and when my kids will notice whether I'm talking about a game with odds or, having a same game multi on the footy or whatever, or watching the races, and it's that fine line, I guess, between them seeing a normal, healthy someone that just likes a little bit of a punt and someone who it takes hold of them sometimes, I guess.
Absolutely. Gambling is a conversation we need to have. We are a country, we're actually the world-leading country in terms of gambling losses. So we need to have that conversation. And one of the things, one of my colleagues was telling me a story about how he was at the footy training with his 7-year-old. He asked, he was collecting money to pay for the umpire, and his son and the teammates asked him, "Dad, are you having a punt on the game to see who's going to win?" So that mentality...
On the junior game.
On the junior game.
Yeah,
so
right.
It's been so entrenched that having gambling as part of even children's sport, it's a conversation we need to change, and it's a conversation we need to honestly have in this country.
Alcohol is another cultural one in Australia. I guess it was a rite of passage. I wonder if there's a shift underway already. It seems younger Australians turning 18 are drinking much less and not getting as drunk, and it's almost this maybe positive element of social media. They're so scared of it, they don't want to end up with an embarrassing moment. When I grew up, there was no Twitter or Facebook, and people might have told you, what happened on Monday, and then that was the end of it. Is that getting picked up in anything you're looking at the moment?
Yeah, Tom, I think it's a really great point. I think the great news is that young people are drinking less and drinking later. That doesn't mean that there's certainly a population of young people, though, who do drink and drink excessively. I think the biggest trend we're seeing, though, is a greater amount of people drinking in their 30s, 40s and 50s. So we're seeing this huge increase in a population, again, that don't want to talk about it. And we're seeing more people in that age range...
Get home, Friday night, whatever it might be.
What we saw during COVID is we saw a population who were locked down, who were doing homeschooling, who were disconnected from all their support networks, and they were drinking much more, and they were calling ambulances because of alcohol-related harm.
Okay, so they were talking about cultural shifts within society. What about policy-wise? One that always comes up is decriminalisation of drugs. Where do you sit on this?
Well, I think what's really clear at the moment is we have 50 years on a war on drugs, and I think what's really evident is that it isn't working. So the current response isn't working. What the next response is something that we have to have an honest and open conversation about. So I think if something's not working, we need to look at all the options and we need to discuss what is happening. And globally, we're seeing a whole change in drug policy. We're seeing countries, North America, South America, Europe, the decriminalising and even legalising cannabis. I think the important thing we have here is we have an honest discussion around what the evidence shows, and we need to think about what's going to work best for all of us.
It's interesting because a lot of it suggests if someone gets caught up in the criminal justice system for personal use, that can actually be quite a net negative on their lives. But there would be people for whom the thought of doing something illegal means they never try something. So you've got to balance that up, right? So, for people that go, I'm not touching that, it's illegal. When it's legal, I'll try that, and who knows what that leads to.
Yeah, I think that's a really common idea. I think the evidence doesn't show that, though. I think what we show is when we have hard punishments on things, that doesn't stop people from engaging in that behaviour.
Well, this must be a numbers game, because there would be people for whom that would stop.
Absolutely.
But it's what the size of one cohort that's getting badly affected by versus the size of the other. So you still think the number of people badly affected far outweighs the number who never tried it because it was illegal?
I think we can all agree that we want our police to focus on hardened criminals who are at the head of drug trafficking or head of, the whole criminalisation. But the bulk of people who are arrested in this country are for single-use possession and don't have any other issues and are not harming anyone else.
All right.
And that is actually affecting their whole career. So, and their whole choices in life.
Maybe what you need is changes of, even if they get arrested, what happens after that.
Exactly. We just need balance here, and we need to think about what's best to make sure we have the most productive society.
Always like a good policy discussion, so it's an interesting thought. Professor Dan Lubman, thanks for your time today.
Thanks so much.